Let's discuss burns. Thermal, chemical, and electrical burns, which are injuries to the skin and underlying tissue caused by heat, chemicals, or electrical energy. Here are the key concepts you should know about burns. The skin serves as a protective barrier against infection and fluid loss. However, burns compromise this barrier, leading to pain, fluid loss, and increased risk of infection. The severity of a burn depends on its depth, extent, and the type of burn sustained. Burns are classified into three primary types based on their causes. The first is thermal burns, which result from direct contact with heat sources such as flames, hot liquids, or steam. The second type is chemical burns, which occur when the skin is exposed to strong acids, alkalis, or other caustic substances. The last type is electrical burns, which develop when an electrical current passes through the body, potentially causing deep tissue damage not always visible on the surface. Now let's talk about classification of burns by depth. Burns are also categorized based on how deeply they penetrate the body, and more specifically, the skin. A superficial burn, also called first-degree burn, affects only the outermost layer of the skin, called the epidermis. These burns cause redness, pain, and minor swelling, but do not blister. The next type is partial thickness, also called a second-degree burn. These burns extend into the dermis, the second layer of the skin, causing blistering and significant pain as well as swelling. These burns may appear red, moist, and blistered. Full-thickness burns, or third-degree burns, penetrate through the epidermis and dermis, reaching the subcutaneous tissue, also called the hypodermis. The affected area may appear charred, leathery, or white, with little to no pain due to the fact that the nerves have been burned and destroyed. However, patients with a combination of second-degree and third-degree burns may still present with pain. If you didn't already know this, there is one last type of burn that is not commonly discussed. It is called the fourth-degree burn. These burns, again rarely discussed, extend into muscles, bones, and tendons, often requiring surgical intervention and posing a significant risk of infection and shock. Let's discuss the three main types of burns in more detail. Thermal burns are the most common type of burn and result from exposure to heat. This can happen when somebody is exposed to open flames, hot objects, or scalding liquids. The severity depends on the temperature and duration of the exposure. Proper treatment involves removing the source of heat, cooling the burn area with lukewarm or cold water, covering it with a sterile dressing, and preventing further injury or infection. You should never use ice to try to cool a burn, as the extreme cold from the ice can cause an ice burn itself. In addition, you should never put burn cream or any oils over a burn. Burn creams and oil can insulate the heat and trap it in the skin, which will lead to further damage and worsening of the burn. In addition, you should know that heat can continue to cause injury for several hours as the tissue retains the heat, leading to ongoing cellular damage and delayed inflammatory response even after the heat source is removed. Now let's talk about chemical burns. Chemical burns occur when the skin or eyes come into contact with caustic substances like acids or alkalis. These burns may continue to worsen until the chemical is completely removed. To manage a chemical burn, immediately flush the affected area with large amounts of copious water for at least 20 minutes. However, if you notice a powder substance on the patient, you should brush the powder off the patient before you flush the area. Make sure you are wearing gloves when you do this. In addition, you should avoid neutralizing agents, as they can cause additional heat and worsen tissue damage. In addition, you should remove contaminated clothing to prevent continued exposure. Lastly, for chemical burns, just like with all types of burns, you should provide supportive care and transport the patient to the hospital. Now let's talk about electrical burns. Electrical burns can be deceptive, as external damage may appear minor, while internal damage can be severe. Patients can suffer cardiac arrhythmias, muscle breakdown, and nerve injuries. Treatment includes providing supportive care and rapidly transporting the patient to the hospital. ALS providers should be monitoring the patient's cardiac rhythm, as patients who suffer from electrical burns are more likely to suffer from cardiac arrhythmias. let's talk about some key management techniques that you should use for patients who have suffered from burns. This goes for all burn types. First, you should make sure the area is safe. Second, you should attempt to move the patient away from the heat source or move the heat source away from the patient. This is to stop the burning process. Next, you should assess for jewelry or any tight clothing that needs to be removed. Knowing that the injury site may begin to swell, it would be appropriate to remove jewelry and other tight clothing as soon as possible. Next, assess to see if the burn area is greater than 10% in children or greater than 20% in adults. If it is less than 10% in children or less than 20% in adults, you can cool the area with a moist, sterile dressing. However, if it is more than 20% in adults or 10% in children, you would want to avoid cooling the areas as it can lead to shock. You should also monitor the patient for signs of shock. If the patient is exhibiting signs of shock, you should treat them for shock. Treatments for shock include laying the patient flat, keeping the patient warm, administering oxygen as appropriate for the needs of the patient, and initiating rapid transport. ALS providers can also initiate IV access and administer IV fluids. If you're wondering how to calculate how much of the body was burned, make sure to watch our video that goes over the rule of nines. That video goes over how to calculate the total body surface area of a burn. Want to watch the full video? Watch the full video and get so much more with your full access membership by going to howtonremt.com or scanning the on-screen QR code now.